Hello, everybody. My name is Rob Dont. I work at the Environmental Health Unit at Doctors Without Borders, or MSF, in the Brussels office. So in the next 10 minutes, I will present a study we did on MSF's flood risk management process during 2 consecutive floods in Mabior, Eastern South Sudan in 2019 and 2020. So in those years, 2 floods occurred in Mabior, as I said, which were both large scale. So in the area, around 100,000 people were affected in each year, which is about half of the population residing in the area. And the Mabior area was already affected by protected crisis previously. So with recurrent violence, displacement, and also general low access to healthcare or water and sanitation infrastructure. The area is inhabited by the Murle population, which are pastoralists, and so who travel around with their cattle throughout the year through different grazing fields, especially also in the rainy season when floods are likely to occur. And so at the time, MSF supported 3 health facilities, and in the map you can see the lighter blue areas, which were areas that were affected during 1 year, and the darker blue, which were affected during both consecutive years by the floods. So this is to give an impression on the scale of the flooding and also a bit the complexity of how to intervene in such an area. So during the study, it is actually based on kind of discourses that have been going on or launched over the last decades or a bit longer on the need to rethink and improve disaster management approaches at the government level, but also by humanitarian actors. And so to be better prepared on the one side and to include forecasting and early warning of extreme weather events where possible, such as for floods, that then could lead to earlier action to be taken, and the need to strengthen responses in general, to strengthen disaster responses, and to include in there as well an aspects of build back better or the recovery phase, to not forget that phase. So there is this commitment in the humanitarian sector to work on these different aspects of improved disaster management. But there are still some gaps, let's say, or questions on what this looks like in practice, what this looks like operationally, and how this actually impacts or improves, ideally, our operations. So, and that's some of the questions we try to demonstrate or answer through this study. So for the study, we tried to capture and analyze data by going through intervention documentation and by interviewing MSF staff that were involved in either the planning or the implementation of the flood response in Mabior in those years. And so we structured the data we extracted on 2 axes. The first one being a temporal axis that was based on the different phases of the disaster management cycle. So the first phase being preparedness, and preparedness with the eye of maintaining operational readiness when a flood would occur, and to check whether flood risk monitoring was included in this preparedness phase or not. Then if a warning was actually used for an imminent flood, and if then anticipatory actions were taken before an imminent flood to safeguard operational capacity throughout the flood and to start also proactive mitigation of possible impacts of this flood towards the affected populations. The third phase was on the actual response phase during the flood, how we assessed how impact assessments were conducted and what actions were taken to reduce the health or humanitarian impacts of the flood that occurred. And then the last phase we investigated was the recovery phase, so whether and which actions were taken in terms of service rehabilitation, be it for health facilities or water and sanitation facilities, and with also the objective to further reduce impacts also in the post-flood phase. So the second axis of data that we tried to capture and analyze was on the different operational domains that were covered during the intervention. So we tried to assess whether actions were taken in terms of flood risk understanding and which ones, which actions were taken in terms of healthcare provision, water and sanitation, support to displacement generally, so also NFIs, for example, nutritional support, and then which links were made with the community and in terms of coordination with other actions. So we tried to gather all those data on actions taken by MSF during these both flood interventions, and then we analyzed those. So in terms of results, what we saw is that in 2019, the regular project was running in Mabior, and there was actually very low flood alertness by the MSF teams in the area, and also not really a familiarity with forecasting tools. So they're actually quite surprised when the flood occurred. There was no warning really, and when the flood happened, it actually destroyed part of the hospital and a big part of the pharmacy of the project. The team then was evacuated and external support was requested. So when all this combined resulted in a 1 to 4 week response gap, actually before we were ready again to start actually intervening for the impacts of the flood that occurred. When we started the intervention, assessments to get a better overview of what the impacts were mainly aerial assessments, so using helicopters, for example, quite expensive. And the care provided during the intervention was also very facility based, so mobility was quite reduced. During the recovery phase, the main aspects of recovery were actually reconstructing the health facility that got destroyed previously on more or less the same location. Then a period of violence erupted, so the team had to evacuate again, but came back early 2020 as a kind of more emergency intervention. And this team already had a much stronger alertness on floods based on what they had seen the year before. So they were actually following rainfall forecasts. They were also doing local observational, they were doing local observation of river levels to understand how imminent the flood would be. And this really led to much more operational readiness to shift into a flood response when it would be required. And so it was required actually in 2020. They used an early warning of an area that got flooded in 2019 to, when they saw this was flooded, to actually start anticipatory actions. So that they started pre-positioning relief items and boats into the area. And they did an early launch of healthcare provision and wash intervention. So they started mobile clinics before the flood actually happened, and they started water distribution as well in the area, so emergency water distribution. And so this really safeguarded MSF's operationality throughout the 2020 flood response. So during that response, 5 weekly mobile clinics were actually set up in the Mabior area, so much more mobile approach than in 2019. And this resulted in a doubling of the consultations that we managed to conduct actually during the flood. And also the volume of water distributed through an emergency water surface water distribution system was also doubled. So quite an increased impact, let's say, that we managed to do in 2020. In the recovery phase, the team focused strongly on borehole repairs, so boreholes that were flooded and so non-functional anymore in the area, to get them back up to speed, and in that sense also try to reduce gastrointestinal infections, for example, in the post-flood phase. So what we extracted from this data were actually quite some shifts in practices between the 2 years. So in 2020, really monitoring of flood forecasting was much improved, and also combined with observational data of local river levels. And this led really to a trigger for action. So teams were willing to also use this data and shift to anticipatory actions. There are some questions still that remained on really how to define these kind of thresholds to shift from an alert into really anticipatory action. That's really, there were some, lots of discussions around that. And also how to go about data brokerage. So a lot of this flood monitoring data, there's quite a lot out there to know exactly the quality and how to use those by field teams. This is not always straightforward. So we call this data brokerage. So interpreting and using this forecasting and early warning data, I think that's could still require further support. Then in the 2020 intervention, really the added value of anticipatory action was demonstrated, and of proper readiness by, as I said, doubling the medical consultations provided, doubling the volume of water provided on a daily basis, and also not having this response gap of a couple of weeks, and not having the health facility or pharmacy destroyed. Questions that were raised linked to anticipatory action were, of course, the risk of acting in vain. What if no flood would have occurred? But then discussions went in the way to identify low risk interventions, basically, that could benefit the population regardless of a flood occurring or not. So an advantage there for MSF is having this funding flexibility, that we don't need to ask for additional funds to be able to start these kind of anticipatory actions, which is not the same for other humanitarian actors. And that funding flexibility is actually quite needed if you want to put in place anticipatory actions. What also came out is that really mobility, having proper mobility in the area for doing proper assessments and delivering primary healthcare, so through mobile clinics, is really crucial. So shifting from facility-based care provision through a flood to a much more mobile care provision really also increased the number of consultations and populations we managed to reach. Questions there raised, of course, the level of care you can provide through mobile clinics is not the same as you could do in a health facility. So it always needs to be balanced. But the teams did have a strong preference for the more mobile approach. So apart from those shift in practices, what actually emerged from the data and especially in the interviews with our teams was shifts in mindset. And I think that's really, really crucial. So really a mindset in accessing flood risk information, so and really eagerness to use that information and to really have a flood lens from the start in the intervention in Mabior. They know it's at flood risk area, so in the planning and response definition, the possibility of shifting to a flood response was there from the start. Especially also then there was a willingness to act early in the year of 2020 and to invest in that. And so they need to prioritize mobility and accepting the limitations that come with this mobility. So all shifts in mindset, and also a shift in mindset that occurred was really this willingness to collaborate and coordinate closely with the people that were intervening in the area, that were still present there. As one of our staff members said, once the flood happens, you have to collaborate with everybody because water affects everybody equally. So shifts in mindset, a bit the questions that we raise is, okay, how can we now achieve this mindset for flood alertness and responses to being a kind of default mindset? So in 2020, it was strongly experience-based, kind of on the trauma of the 2019 intervention. And actually, or ideally, this kind of flood mindset should be present in for any humanitarian intervention in at flood risk areas. So how to get there, I think there's still quite some work to be done. Another aspect that we really identified as need of further investment and attention was the role of communities. So as said, the Murle population, for them, cattle is really crucial. The floods occurred during the time when a big part of the population was actually moving around with the cattle to the grazing fields. And so it's very difficult to have information of where actually people were at the time of the flood, and so how to reach them. So having a much better understanding of how these movement patterns work and where people would go to could have really helped in identifying and reaching affected populations much quicker during the actual floods. So all this combined led to the recommendations to really further mainstream and contextualize hazard monitoring. So not only using online data, if you want to call it like that, but also combining this with local observational data. That really was important. And to further operationalize and document anticipatory actions. Which anticipatory actions do we want to put in place? What is feasible? And what, how to get there. Then also to update the flood preparedness and flood response guidance. At the moment, the flood guidance we have at MSF does not yet include aspects of flood forecasting, for example, and how to use those in response preparedness and planning. And so that update is really needed. And as said, to really connect proactively much more strongly with local communities and stakeholders on their health practices, but also on the health, the flood impacts they expect, and what are their coping strategies, and how can those be strengthened. And then through this research, we also try to further disseminate these kind of experiences and contribute to a shift in mindset, in flood alertness and awareness. Okay, so this was my time. Here you find my contacts, and I'm available for any questions you might have. Thanks a lot.